going to give it a few minutes to allow people to get logged on and settled in. So, oh, yeah, looks like the numbers are ticking up. So we can give it another 20 seconds. That would be great. We appreciate your patience, everyone. All right. Okay, well, we're going to go ahead and get started. Welcome, everyone. Good evening. I am Deborah Petraka. I am the Marketing Director here at Chicago ENT, and I'd like to welcome everyone to this evening's presentation, Advances in the Treatment of Obstructive Sleep Apnea, Inspire Therapy. We're so glad that you could join us today, and we've been doing these presentations pretty much every month, and I think this evening's is our largest group. So we're so excited that you're here. And I'd like to take a moment to introduce our panelists. First, we have Jen Kasler, and Jen is a territory manager with Inspire Medical Systems. And we're also pleased to have with us today Jay Feckman. And Jay is an Inspire implant recipient, and he's also our patient ambassador. And he is here to share an overview of his firsthand experience with Inspire and how it has impacted his life. And he is welcome to answering any questions that you may have. And finally, it is my distinct pleasure to introduce Dr. Michael Friedman. Dr. Friedman is the medical director here at Chicago ENT. He's also the chairman of otolaryngology, head and neck surgery at Advocate, Illinois Masonic Medical Center. Dr. Friedman is an internationally known expert in the treatment of sleep disorders, and physicians from all over the world are familiar with Dr. Friedman as he has created the Friedman staging system. And this is a clinical method for selecting patients with obstructive sleep apnea who are likely to benefit from surgical interventions. Dr. Friedman has been involved in the original research back in 1995 with hypoglossal nerve stimulation therapy, which is Inspire. He has authored literally hundreds of papers and 2 textbooks on the topic of sleep apnea, and has been recognized by Castle Connolly and Chicago Magazine year after year as a top doctor, in addition to many, many other awards. Dr. Friedman is a true pioneer in the field, and we are honored to have him here with us this evening. Before we begin, I'm going to turn it over to Jen to go over some housekeeping items.
Thanks, Deborah. Dr. Friedman, if you wouldn't mind advancing the slide. Good evening, everybody. Thank you for attending and taking time out of your night to join us. I just wanted to let everybody know that this meeting will be recorded. We will stop the recording before questions. Dr. Friedman, if you could advance one more time. If you could, please save your questions till the end. However, if you do have a question that comes up while the presentation is proceeding, please type your question in the Q&A bar at the very bottom of the screen. And as Deborah mentioned, Dr. Friedman and Jay are happy to answer your questions at the end of the presentation. And with that, Dr. Friedman, I will let you take it away. Thank you very much.
Thank you. Thank you, Jen. Thank you, Deborah. And thanks, Jay, for joining us and taking of your time to share your experience. And I think, like Deborah said, we're excited to be here and talking about this because literally for the first time in 40 years, we have something we feel very great about in terms of an option to CPAP. For years, we've struggled with different attempts for surgical procedures that were better than nothing. They were better than doing no treatment, and many patients just cannot tolerate CPAP. But with hypoglossal nerve stimulation therapy and with Inspire, we have a real option that everybody's confident about in terms of being minimally invasive in the sense that it's not dangerous, it doesn't change the anatomy, and it's highly effective. So I want to talk a little bit about sleep apnea. I'm going to tell you probably things that you already know, but I think it's worth just going over some of the basic principles. Well, we know that when we're awake, and normally when we breathe, air goes through our nose. Now, we're primarily nasal breathers. We do breathe through our mouth, but we're made to breathe through our nose. So if we're congested, if we have a cold, then we have to mouth breathe. We're not very comfortable when we do that. So no air goes through our nose, and then air goes behind the palate. This is the palate, and behind the tongue. And even patients with snoring or patients with sleep apnea, mild, moderate, or even severe, they're breathing fine during the day. They're not making noise. They're not snoring. They're not obstructing. Their oxygen stays perfectly in a normal range. So what happens? Well, all of us have muscle relaxation when we fall asleep. That's normal. And our muscles relax, which means that our palate and our tongue tend to fall back. Now, if we have a narrowed space behind the tongue and behind the palate, or if we have a tongue that's maybe a little bit larger than it could be or it should be, then when the muscle relaxation takes place and the tongue falls back, we obstruct. And that's when the patient with sleep apnea will start snoring and go or start obstructing and actually block off their breathing, and the oxygen drops. And what happens is the oxygen drop causes an arousal, and then the patient will catch a deep breath and come out of that, and the process starts over and over again. So, of course, it's called obstructive sleep apnea because the problem occurs during sleep. So for years, we struggled with the idea of is how do we keep this area open when the patient is asleep? Now, one thing that seems obvious is if we can keep the tongue awake when the patient's asleep, then there won't be a problem. Now, an apnea means that there's no airflow. And the apnea could be anywhere from 10 seconds to 60 seconds, 70, even up to 2 minutes sometimes. If the apnea is short, if it's less than 10 seconds, we don't consider it significant. But it is, in a sense, significant, but we talk about apneas that are greater than 10 seconds, and it's what happens when the patient obstructs and there's no airflow going through at all. Now, I think all of you who are listening probably have a good understanding of the consequences of sleep apnea. And I think the most common symptom that brings people in is snoring. People come in because the bed partner is complaining. However, the bed partners are not only complaining about the noise that's keeping them awake, but they're complaining because they're concerned. Patient after patient comes in and tells me, I was afraid that he was going not to wake up. He would stop breathing, and they would count how many seconds it is. So snoring is the most common symptom, but there are many, many other consequences. Fatigue. All of us are overworked and we don't sleep enough. So it's very common that people are tired, and they attributed that fatigue sometimes to many other reasons. But sleep apnea is a major cause of fatigue, and it's very hard to overcome that. And the risk of accidents is significantly increased in patients that have sleep apnea, and it's comparable to driving under the influence. Sleep apnea can cause high blood pressure, heart disease, impotence. It causes weight gain. We know everybody is aware that weight gain causes sleep apnea, but I think what a lot of people don't realize is sleep apnea causes weight gain. Sleep apnea affects insulin metabolism. So it means that patients with sleep apnea don't metabolize carbohydrates. So they can eat the same amount and then they will gain weight. When they gain weight, the sleep apnea gets worse. The sleep apnea gets worse, then they get fatigued, they're tired. You still have to get up, you have to go to work, you have to do what you have to do, but then you're tired. So your activity level drops down, and then you gain more weight. It's a cycle that we have to overcome. Weight gain, I mentioned is something that causes sleep apnea, but sleep apnea causes weight gain. Commonly, patients will complain of headaches, especially morning headaches. Today I had a patient that complained of headaches waking him up in the middle of the night. When you're tired, and you're always tired, nothing is fun. So depression is a secondary consequence, and it's common to be secondary to being tired all the time. So, and again, probably everyone listening knows what CPAP is. And CPAP is a great therapeutic tool. In 1977, we started doing early research on sleep apnea. We had nothing to offer the patients. CPAP was not available. There was no such thing. The first CPAP was a result of somebody taking a vacuum cleaner with the exhaust pressure and putting on a medical mask and seeing that it really helped these patients who were essentially choking in their sleep. So CPAP has come a long way since 1980. And for some patients, it's great. They don't mind it. They're comfortable. It's natural. They just fall asleep and stay asleep. But it's just not for everybody. Some patients, their personality is just such that they're not going to be comfortable with something on their face. Some people that are just insecure about sleeping with CPAP with the bed partners. Some people just have continuous arousals. I have patients where the CPAP works, but it keeps slipping off and moves to the side. They can't sleep in the position they want to sleep on. They're tethered to one side. There's reason after reason why CPAP does not work for everybody. And we always encourage everybody to try CPAP. But if it's not for you, then it's time to move on. Now, and we have patients that use CPAP, but they're just tired of it. They're tired of being constantly tethered to the CPAP and constantly in the need of bringing their CPAP wherever they travel. So for the first time, we really have alternatives that are meaningful and helpful. Now, what did we have before? There were always options for sleep apnea. And one of the options are custom designed oral appliances. And those are great for patients who have very mild sleep apnea or snoring without sleep apnea because they're effective. And in many cases, they're tolerated well and patients are compliant. They're not very effective, however, for patients with moderate or severe sleep apnea. And for a long-term care with moderate or severe sleep apnea, the amount of pressure or pull on the lower teeth becomes a problem, and it can cause shifting and can become uncomfortable. So we have a dentist that specializes in dental sleep prosthetics. And we find it to be extremely helpful for patients with snoring or mild sleep apnea, but not as helpful for moderate or severe. So what were our options in the past? Surgery. Well, surgery involved taking out part of the throat. And I never liked doing it. I always felt there's something wrong with taking out normal anatomy. When we used to reduce the tongue to make more room because we had no other choice. So we had to cut away the tonsils, we cut away part of the palate, and we used a robot to reduce the size of the tongue. And it did work, but it was a very destructive surgery because even if it worked, a patient's throat was changed forever. Also, these surgery techniques were painful and dangerous. So I was involved in many, many techniques over many years, and we always did them reluctantly. Inspire is the first time we can offer something with a full confidence that we're certainly not going to cause any kind of problems. And that's what our main concern is. We want to have an option that's safe and relatively simple. So what is Inspire? One is it's an outpatient procedure. Unlike any procedures in the throat that can cause problems with the airway or bleeding or breathing, Inspire does not really require any kind of surgery or cutting on the inside of the throat. The concept is simple. If we can put in a small little chip on the nerve and keep the tongue in an awake position when the patient's asleep, the tongue won't fall back. And that's all we need to accomplish. All we need to do is to put the nerve that moves the tongue is right underneath, it's right underneath the chin. It's right below the skin. So that electrode goes on the nerve that moves the tongue. And then, of course, we need a power supply. So there's we bury a small battery underneath the skin that you can't see. And when the patient is ready to go to sleep, they have a remote control that just turns it on, and the tongue, instead of falling back, stays in the forward position because it gets a little stimulation from the battery. There's also a sensor that senses and coordinates the breathing. So this is how it's turned on. And there's the sensor between the ribs that sends the message and says the patient's taking a deep breath. The tongue, instead of falling back, should be stimulated and just come up to where it's supposed to be when the patient's awake. So we prevent this tongue from falling back. We keep it in the forward position. And once it's in the normal forward position, there's no issue. So I want to show you this clip about Inspire.
device implanted. You just need to relax and breathe normally. Peggy went to a sleep lab to see how it was working. Listen for me on the intercom, okay? Good night. They ran tests throughout the night, and early the next morning, Dr. Boo reviewed the results. So before we activate the device, we have all sorts of problems. This is basically your brain scan. I'm not breathing, I need to do something about it. And after we activate the device, it's perfect. Look at your eyes. Nice, stable, flat line, staying around 96, 97%. So this is as good as it gets. And as far as I'm concerned, this is a cure. This is awesome. A study in the New England Journal of Medicine found that more than 2/3 of patients experience less sleep apnea after getting the implant.
It was like sleeping with a herd of elephants.
For years, all Peggy and her husband David wanted was a good night's rest, and now they're finally getting it. Every night, Peggy turns on the implant right before going to sleep. What's it like to sleep now?
Great. Turn myself on. Go to sleep. And I sleep. And then I get up and I turn myself on. And I have a normal day like you and everybody else. Come here, Max. Come here, Toodles.
Done work for everybody, but man, it worked for you.
It sure did. It saved my life.
Yeah. Now, Inspire is not for everyone. It's only for moderate to severe cases like Peggy, and like any surgery, there is a risk of infection. For Peggy, she says her memory is back to 100%, and she's sleeping great at night.
And does insurance cover it?
So insurance, it's a case-by-case basis. Her doctor had to kind of nudge the insurance company along with you.
Well, she must really love her husband after saying on national TV. Sounds like a true hell.
But they're sleeps together.
Yeah. That is really great news. So does she wear a mask when she's got the implant?
Not anymore. Not anymore. And when she turns it on, she feels nothing. She can just feel it pulsating in her tongue. Totally.
Life-saving.
Oh, it is. Absolutely.
So I'm sure everybody's wondering, what's the surgery? What is it like? What's it about? What's going on? So it is done with the patient asleep. And it takes about an hour for the actual surgery, but there's a lot of preparation before and preparation after. And it does involve 3 incisions. There's one incision that I mentioned that's right below below the chin. Now, generally, that incision heals and it becomes invisible very soon after the surgery. There's a second incision to implant the battery, which is in the upper chest, which is below the skin and is not visible. And finally, there's a third incision between the ribs where the sensor coordinates the breathing with the tongue so that there's a deep breath in, the tongue stays in a proper position. So patients usually stay a couple hours after the surgery. They go home the same day. Usually they're not in bed. There's no question that a surgery that makes incisions hurts, and everybody's different. Some people will say it hurt for a few days. Some people say it hurts longer. Some people have very little pain. We do use some pain medication if they need it. We do ask them to baby the right arm and shoulder, not because there's a problem, but because these thin little connections or wires have to heal in place, and we don't want to take a chance with shoulder movements affecting those wires. So we are concerned about that, and we recommend no sports, no baseball, no volleyball, no football. We want to keep the shoulder kind of at rest for a while, but otherwise normal activities are fine. The battery, everybody wants to know about the battery life, and it's designed for 11 years, but switching it out for new batteries is a very simple procedure with just a local anesthetic. And the other question everybody often asks is, sometimes an MRI scan is needed for the head or the neck, and can they be done? And with the new Inspire devices, MRIs of the neck and head can be done. So that is not a problem. The recovery, as I said, is outpatient, and you're not in bed. There might be some pain, but you can eat whatever you want, and you're up and around. And the only thing that is extended for a while is we want everybody to baby that shoulder. So when we do the procedure, there's the small little electrode goes on the nerve, the battery's put in, the sensor put in, then we test the whole system. We want to make sure that, the sensor senses properly and that the tongue moves out properly. Once we are comfortable that the system's working perfectly, we then turn it off. It's turned off for 30 days until there's a follow-up visit, at which time it's activated, and then we allow the patient to start using it at home and start adjusting it to make sure that he's comfortable with the amount of protrusion. And then we find that happy medium where he's comfortable, but there's enough change of position to keep the patient from having episodes of apnea. This is a typical visit after 30 days where the system is activated and then settings are set. It's a very painless, simple visit. And of course, there's a whole system for educating our patients on how to adjust it, how to turn it on, how to turn it off, and how to take care of it. Now, does it work? Now, this is what the study shows. Now, there are literally hundreds of studies now that have proven the effectiveness of Inspire. I review studies for many medical journals, and there's a continuous flow of large series of papers that have studied this. The way we grade sleep apnea is by the number of episodes of obstruction per hour. Now, an apnea means a complete obstruction. Hypopnea is a partial obstruction. Both cause a drop in oxygen, both cause arousals, and both can be damaging to the body. So we combine them and we call it the apnea-hypopnea index, or many of you might have heard the term AHI, which is crucial for determining the severity of your problem. We look at episodes and we look at the average per hour. Well, the average per hour should be 0. There should be no episodes of obstruction or oxygen drop. But if there's less than 5 episodes an hour, it's not normal, but it's not seriously dangerous. So we usually don't treat less than 5. Anywhere between 5 and 15 episodes per hour, we consider mild sleep apnea. 15 to 30, we consider moderate, and more than 30 episodes an hour, we consider severe. Now, in this group of patients, before the average was 29.3. That means there were many patients that were less than 29, but many patients were much worse than 29. This is moderate range. The average after Inspire placement was 6.2, which is an amazing improvement in the apnea-hypopnea index. What about snoring? As I said, most of my patients snore. The only ones that don't snore are the ones that sleep alone. But patients typically that have sleep apnea typically do snore, and usually it's a problem. For some bed partners, it's not a problem. Patients that sleep alone are often misdiagnosed and often since no one's there watching them snoring, nobody watches them gagging or choking, it's a very severe form of the disease where the patient himself recognizes the problem. So patients that live alone often come in diagnosed very late with very severe disease. But the patients that do have a bed partner, 83% complained of significant loud snoring before Inspire, and that was down to 10% after. So for most patients, the snoring is markedly improved. An 88% reduction is what the studies show. Now, do patients like it? And this is based on satisfaction surveys at the final visit, usually 1 year or later. And 94% have positive feedback, which is amazing. And it's amazing because it is not totally effective for 94% of the patients. It's highly effective for all patients, but it's totally effective for 75%. But even the ones where it's not totally effective, they are very loyal to their Inspire. So they don't give it up. They still use it. They don't want to go back to their CPAP. So the satisfaction rate is extremely high at 94%. And further evidence of this is that patients are using it. Unlike CPAP, where we find half the patients do not qualify for the 4-hour cutoff, the average for Inspire is almost 6 hours. So patients have it, they use it, and they like it. There's many, many studies that have been published showing the efficacy. New England Journal, which is the most prestigious medical journal there is, has published on it and has shown the good results. There are thousands of patients being followed for continued assessments and analysis. It's available now for the first time with most insurances covering it. When I started doing Inspire, every case was kind of a battle. Every case was a case-by-case situation where we had to convince the insurance company. It's not true now. There are still many situations where we might have to do an appeal, but basically it seems that most insurance companies will cover Inspire if the indications are proper. If we choose the right patient for the right procedure, most of the time it is covered. It's covered by Medicare, and I have not worked at VA, but VA and military hospitals, I understand, will also cover it. So who is the right candidate? Well, as I mentioned, it's not for snoring and it's not for mild. It is for snoring if the snoring is a result of sleep apnea, and it's for moderate or severe sleep apnea, which means usually more than 15 episodes per hour. It is, I think, a benefit for people who do not want or cannot use CPAP for many reasons. If CPAP is not right for them, then Inspire is the right solution for those patients with moderate or severe. One battle that we run into on a daily basis is weight. Many of our patients are overweight, and even many are mildly obese, are in the obese category, but they're still good candidates for Inspire. However, there is a cutoff where insurance companies will not approve Inspire if it's very severe morbid obesity. We of course want to choose the best candidates. So the way we choose the best candidate, the final assessment, is based on an airway examination with the patient snoring and asleep. Now, in order to do that, we have to bring them to either our office with an anesthesiologist or the operating area. And it's a procedure that's called drug-induced sleep assessment or sleep examination, DICE. And what we do is we just bring the patient in, and an anesthesiologist gives a little sedation. The patient, we just wait for the patient to fall asleep, and then we examine the airway. The pattern of collapse when the patient's snoring will tell us if he's an excellent candidate or not. There are certain situations where patients are not good candidates, and we want to know that in advance. Right now, it's approved for patients over the age of 18, although there are centers that do treat children with severe sleep apnea with Inspire. I do not do pediatric surgery, but there are centers who are doing a lot of research and a lot of work for children under the age of 18 that have severe problems. Before we ask Jay to share his experience, I just want to also encourage everybody to look at both the Chicago ENT website and the inspiresleep.com website that has a lot of information. And I think I'm going to turn the floor over to Jay, who will tell us about his experience, and then we'll have time for questions and answers.
Thank you, Dr. Friedman. I was diagnosed with sleep apnea in 2018, so not even really that long ago. And I knew I was having a lot of problems sleeping. And it didn't occur to me at the time that what it was sleep apnea. I had had sort of a long period of just, sleeping, falling asleep throughout the day, and always waking up at 3:30 a.m., which seems to be about the time my body would just say, you don't have enough oxygen, wake up. And so that was the routine for a few years. And then my partner told me that I was snoring a lot. So of course, there's always the joke, which is, that's ridiculous. If I was snoring, I would wake myself up. And then I realized occasionally I would actually wake myself up. And then you do that look like, what was that? And then realize, oh, that's me. That's how bad my snoring is getting. And so, and I started going to Chicago ENT for allergy and breathing problems. And around that same time, I actually had an incident where I was driving in the middle of the day, and I was falling asleep while driving, but I was convincing myself that I wasn't really asleep, that if something dangerous happened, I would certainly be able to wake up and see it. And then my partner, sort of, what are you doing so close to that truck? And then I was like, okay, that's it. I have to look into this. This doesn't seem to be normal. And so when Dr. Friedman, when I went in, he asked me, I really went in for I initially thought it was allergy and breathing problems. And I did a questionnaire, and one of them was just about sleep in general and being able, if you're still dreaming, which is a good indicator of apnea. So I did a sleep study, and the results came back that I had apnea. And I initially tried CPAP. I had a family member who had a CPAP machine, so I knew about what to expect. It was somebody who got one initially, one of the first ones. It was about, I like to say it was about the size of a Buick. And she still uses it and is very successful with it. But with me, I tried to use it all I could, but I could not get the mask to fit properly. And especially if I moved, and then also to get it to work properly, I always created sort of like pressure on my face, and always sort of had a sore right here all the time. So some days I would have to not wear my glasses, which then became this whole thing. Well, now I have to wear contacts. Now I have to wear contacts some days, which is not the worst thing, but it was just sort of escalating all these other problems. And then for me, I could never get consistent results. I would move sometimes and the mask would shift. And so I was able to sometimes use it 5 hours, 6 hours, which was okay, but that was a lot of things had to fall into place. So I decided to go to an Inspire seminar and then follow through with looking into Inspire and getting it. And it was initially not approved by an insurance company. So there was some convincing of the insurance company that it would be the right thing. And even the final arbitration, I just remember the letter so vividly. It said, why wouldn't you, why wouldn't you let this patient have Inspire? It's going to increase his life quality. So for the surgery itself, it was at Illinois Masonic, and it went fairly smoothly for me, although Dr. Friedman all I did was, I was asleep through the whole thing. And then the recovery for me was fairly easy. I think I took pain medication the first day. The next day, I actually in the neighborhood went for a walk, to an art fair, and as Dr. Friedman said, I had my arm in a sling just to sort of protect it, and it all healed pretty quickly. I think after about a month, I was back into regular activities. And the device itself, after I would say a year, a little less than a year, my snoring really went away enough that it's not an issue anymore. It's certainly not an issue for me, but it didn't go away right away. It took maybe about 8 months, and then now it's really at a much lower level. I also sort of remember to feel more comfortable about it. I read sort of a lot of the stuff that was going to be about Inspire itself, and then I sort of looked through the surgical manual and really looked at like what the remote was going to do, just to become really comfortable. And I will say one more thing about this surgery. For me, my rib cage hurt, I think, the most, but other than that, everything healed up nicely. I had some numbness under my chin, but that's gone away after about 6 or 8 months. So I would definitely recommend it if you're having trouble with CPAP just being consistent. And the most significant thing for me that I've realized when I was just thinking about it is now I easily get 7.5, 8 hours of sleep. And I was thinking about it like before, even with CPAP, I now sort of add a whole extra night of sleep to my week that I wasn't getting before. It basically adds up to 7 hours of sleep extra per week. So it's really remarkable that I can stay awake all day, which was quite a challenge before. So I appreciate everybody listening, and that's my story about Inspire. If you have any questions, I'll be happy to answer them.
Excellent. Well, thank you, Jay. Thank you so much. And thank you, Dr. Friedman. That was really informative. I always seem to learn something new as we do these seminars. So thank you to everyone that's been sending in questions. We have quite a few of them. Friedman, we can kind of put up some of our contact information. So if you would like to learn more about Inspire.
Hey, Deb, I just want to, since we're still unvaccinated for most of the population,
Yeah.
I just want to comment on how this office is completely COVID safe in terms of areas that are completely sanitized, plexiglass protectors, and essentially no waiting in our waiting rooms. Our whole system has changed. People, my patients that know me from 20 years ago can remember a waiting room that had 40 people in it at 9 o'clock at night, but now it's one person at a time that comes in and comes out very efficiently so that nobody's interacting, and we are very COVID safe. Remove that. This is what you wanted, right?
That's where I wanted to go. Yes. So, so thank you everyone for joining the presentation. If you'd like to learn more about Dr. Friedman, you can visit our website at chicagoent.com, and you can take a look at his YouTube video, or you can learn more about him on his blog. You can also read about his recent accomplishments in our blog titled Dr. Friedman, a True Leader in Sleep Medicine. And finally, if you'd like to schedule a consultation with Dr. Friedman, you can book an appointment 24/7 on our website, chicagoent.com, or you can call our office at 773-296-500. You can come see Dr. Friedman at any of our 4 convenient locations. You can follow our social media channels for the latest updates and information from Chicago ENT. On behalf of Chicago ENT and Inspire, we thank you. We are appreciative of your time. We cannot wait to see you in person to take care of all of your sleep apnea needs. Thank you. Have a great rest of your evening. Be well and be safe.
Thank you, Deb. Thank you, Jay. And thank you, Jen. Good night, everybody.
Good night, everyone.
Thanks for listening. Thanks.